In 1992, it was identified that there are substantial economic, social and health inequalities between certain areas of Sheffield.
If you look at the statistics that we have about life expectancy, you can go back as far nationally as the Black Report, when the link between deprivation and poverty and longevity was established.
There is a life expectancy gap of up to 15 years between some poorer and more affluent parts of the city.
Almost all diseases increase in frequency the more impoverished a group of people are. In Sheffield, that difference has become increasingly stark.
An NHS Index of Multiple Deprivation report, published in 2010, showed the difference between the most and least deprived areas of Sheffield continues to increase. In the Southie Owlerton area of Sheffield, Healthy Cross Community Project was established to try and help provide support to the community and empower people to live healthier lifestyles. In 2010, Healthy Cross became Healthworks, with a new focus on spreading into other communities in Sheffield.
There are four main areas of our work. One is health and recruitment consultancy, there's healthy activities, there's training, and there's volunteer development.
I think Healthworks has been an amazing addition to the area here.
Helping people get back into work, helping people to lose weight, helping people to get healthy in all sorts of ways.
Healthworks puts on a range of physical and creative activities designed to invigorate the body and mind and provide a place to socialise and engage with the community.
I think some of the exercise classes have been excellent. They address things not only such as obesity and arthritis, but I think being a member of a group has encouraged some people, because people feel a sense of being part of a community.
Healthworks benefited me on probably many levels as a volunteer. It's helped to build my confidence up.
I'm a volunteer for Healthworks. Before I got involved with Healthworks, I suffered from depression, panic attacks and anxiety attacks, but since being with Healthworks, my mental health has improved so much. They've put me on different courses which I've enjoyed doing.
Given me more skills in working with people, and also allowed me to train in different areas that I never expected to be able to do in the past.
No, I don't feel like I've got a low self-esteem anymore.
It's also helped me to cope with negative things in life, because not everything's good. And it helps you to cope with that with support around you. So I've really enjoyed it in that respect.
By working with other people, working in groups, talking to each other, reacting with each other. Love it.
Healthworks has done so many amazing ways for so many different volunteers. Whereas last year, we had 50% of us volunteers employed, and Fee was actually employed at Healthworks.
It's now actually well beyond debate that poverty is linked with poorer health outcomes.
A 2009 NHS Neighbourhood Health Report stated that the Southie Green area was significantly worse than the rest of Sheffield in the following areas: smoking, binge drinking, unhealthy eating and obesity. This has resulted in significantly more instances of health concerns such as chronic disease, mental health issues, alcoholism, as well as social problems like unemployment, truantism, homelessness and crime.
There is evidence to suggest that where people are living below average incomes, etc., health and aspiration tend to go together. So the sort of projects that we deliver would increase health and improve aspiration over time.
Healthworks has 2 decades of experience in helping people to live physically and mentally healthier lifestyles, and works to have an overall social impact, improving not only people's individual lives, but the community as a whole. also provides training workshops on a variety of health and social issues, with a focus on overall holistic health improvement.
Charities such as HealthWorks that provide these classes and groups really make a massive difference to people's lives and communities.
The Sheffield Directory of Public Health report for 2007 points to research that estimates there are currently over 1 million people in the South Yorkshire region with a long-term health condition.
At this current point in time, with all the changes that are taking place in the NHS, a lot of the community health provision that currently exists over the next couple of years is likely to change or disappear.
We've got a bit of a history in this area of embarking on such projects and seeing lots of really good results from it. And often our projects are taken on in other parts of the city.
Areas where people have lower incomes and possibly areas in which the resources have been cut. HealthWorks and similar charities are becoming more and more essential.
Because we do see enormous benefit from it.
As a result of the consequences of today's unhealthy lifestyles, the number of people in England with a long-term health condition is set to rise by 23% over the next 25 years.
Unfortunately, however much we manage to do in the health service, it doesn't correct for all the deprivation that has been stocked up, generation after generation.
So there's a real urgent case to make sure that the kind of work that we do carries on. And given the fact that we have 20 years of expertise in this area, we feel that we're better placed than any other organisation in the city to help meet that challenge.
We've benefited from the HealthWorks here, so I would have thought in similar communities right across Sheffield it would be extremely useful.
Kids around here, they need a place where they can come and engage with stuff they actually want to do, and we see that we have children coming through the doors to go rock climbing, and when you see their faces and they're enjoying it, it's really awesome, really.